So what we're going to do next, we're going to talk about a couple of the archetypes we're going to get into this afternoon. And what I'd like our learners to do is help me figure out which one I'm showing you, and maybe give me an example of somebody you've run into that fits this type. So we'll start with the easy one. Can you tell me what type of learner this is? Or what the behavior of this learner is? The quiet learner, the introvert, the one who doesn't say anything at all. You know, and the question is always, is it because they're shy? Is it because they don't know what's going on? Is it because they're angry at you or the situation? There's a lot of different parts to this that can come up. The quiet learner, or this guy. This is the easy one, right? This is our Supertalker, right? Someone who has to talk the whole time. And again, how do you change that? How do you address that? How do you redirect without being insulting? How do you bring the other people into the conversation? How about this guy? Everybody laughs. Like, yeah, I know that guy. Have you had this learner? This is the one that either we call him the doubter or the defensive. So either, you know, I'm actually right and you're not, and here's why. Or if I'm not right, it's really because the SIM is wrong. And if it was a real patient, I would have gotten that correct. But you set me up because this isn't realistic, et cetera, right? They become immediately defensive, explaining away why they did something incorrectly or what they did differently. This guy. I don't know if you can read that bottom line. So I'm not lazy, I just don't care. Right? Have you seen this one? Right. Are unmotivated or distracted? This is this learner. Yep. Right. This is Ambrose over here right now. I'm just kidding. Good. And then this one. Bonus points if you can name the movie. Anchorman. Good. Right. This is our emotional learner, and this could go a couple of different ways. And I had some more offensive pictures for this that I didn't put. But you know, people get really upset, right? People get really, really upset because if you do these sims well, people get emotionally engaged in the case, right? And then when something doesn't go well, they could take it personally. And that people react different ways to insult, to fear, to feeling inadequate. They get mad and start yelling at each other or at you, or they get upset. People get the tears come out. People become, you know, self insulting and sad. This one, it's a little more abstract. What are these? Silos. So our interprofessional learners, different training backgrounds, different approaches to things, different thought processes. It's very easy in a debrief to alienate one type of person if you have a variety of different type of people in the room and different training backgrounds. It can be very simple to create conflict by approaching something in one mindset and not the other. And that can make your life difficult. How about this one? What might this represent? It's a little harder. I'm getting more abstract as we go. Say it again. Okay. All right. So, or maybe it's your learner's ability to take care of the patient. So this is how do you deal with somebody who is either consistently or repetitively or unexpectedly wrong. Someone who has a knowledge deficit you don't expect, or to a degree you don't expect. You know, a learner in the room who's way underperforming versus the rest of the room. This could be quite a challenge, right? Or it could be, we call it the bumbler. It could be even worse. You know, legendary fail for when epic fail wasn't enough. This is, you guys can't see it, right? Yeah. And sometimes it's just an epic disaster, right? You're watching this person take care of the patient going, oh boy, right? This is a challenging learner. This is someone who's very different. It's really easy to debrief my super high performing, super motivated, outstanding medical students, right? It's not so easy to debrief the ones you're like, whew, okay, right? Where do we start? When there's a lot going on. Good. So major gaps unexpected. So keep these people in mind this afternoon. These are some of the folks we're going to introduce to you as the afternoon goes on. And what we're going to do in the next little bit, we'll take a break in a second, let everybody stand up and move around a little. We're going to do 5 30-minute small group sessions. Now let me see if this sounds familiar. Our objective of the afternoon, right, is to give you a chance to do some debriefing and get feedback on your debriefing in order to go home a little bit better debriefer, to encounter some difficult learners in a safe environment, and have the opportunity to work on your scripts and how you work with those people and deal with those learners and get feedback from us and tips and tricks and experience and stories. We're all storytellers in this room. And give you a chance to really try this on. Not listen to us talk for 4 hours. We want you to talk. We want you to be engaged and learn. What we're going to do is create cases for you. So you'll get presented a simulation that just happened, right? So your students just did this resuscitation case. Here's what happened. Here's what went well and what didn't go so well. And we're going to have you guys debrief the case. Now, this is a little artificial, right? Our mannequin today is a script that gives you a case and a sim that just happened that didn't actually just happen, right? We're in a conference room with a bunch of other people. It's a little bit limited. It's going to feel a little bit differently than your debrief at home. But we want you to take it as seriously as you can. Put yourself in the frame that you just went through this case. You just watched this simulation. And you're going to lead this debrief. And use phrases that you would normally use. Try to speak in a way that you would normally speak to your students or your residents so that we can participate. We will be your residents and your students, and you will be helping us debrief and learn. So we want you to take this as real as possible, treat it as real as possible, speak in the normal way you would speak so that we can help you get better at this. It's going to feel a little awkward. Because you know many of us, and it's a little different place, and it's a little bit of a strange setting. But we've put some time into this. We've tried to create these cases in ways that will be useful to you. And all 5 of them have a little bit different flavor with different faculty, so really take advantage of that. We know that you're intelligent and well-trained, and you're here to get better. And you're here to learn to debrief and be better debriefers. And we want you to feel free to take that on and own it and do it and be a debriefer for today, regardless of what your training level is. Questions? Right? So that said, let's take 5 minutes. The bathrooms are right there. Stand up, move around. I hope all 4 of you will come back because this is the best part yet to come. And then we'll break you into groups and we'll have some fun this afternoon trying things out.